Hey everyone, it's Michael over here at Home Health Success Academy. So in today's video, I'm going to be talking to you guys about one of the biggest questions that gets asked of me by my clients. And that one question that gets asked a lot is this, is that Michael, how do I increase the chances of me being able to walk into a building and to be able to get the appointment instantly, or to be able to have that one-on-one to be able to give them all my information? Now, it's really hard to do this unless you actually have a process or a system. And we've actually created a system, what we've done, and we've applied the Home Health Success Academy formula into this. It's talking about the clarity, being able to know who are you trying to reach. So if you walk into a nursing home or assisted living community and you don't have any names to drop, yes, you have to learn how to name drop here, okay? If you don't have any names to drop, then you're walking in cold with not a lot of preparation information. So your value is a little bit lower because you're asking for information from a receptionist, from a gatekeeper. So they're going to be of higher value. You need to be able to even the planes out. So when we walk in, we want to be able to make sure we're able to drop a name and have a name already. So when I walk in, hi, I'm here to be able to speak to Janice, or I'm here to be able to speak to Marcus, or I'm here to be able to speak to Mr. Patel. There's a variety of different things that you need to have. You need to have those names. So the biggest problem that happens is, how do you get the name easily? Well, it's going to take some research, but it's also going to take some phone calls. Now, one thing is you need to prepare yourself by getting the names, because if you can't get the names, right, it's harder to get that appointments. At the same time as if you're mailing something to someone and you literally just say attention administrator, attention director of nursing, attention discharge planner, the problem that occurs is that more likely it's going to be put into the junk mail pile. What if you are able to say attention Mr. Patel, attention Marcus, attention Janice, attention Michael, it's going to be able to increase the chance of you being able to get that person to open that letter, to open information about your company. So what we're doing today is I'm going to be able to put you guys in one of my calls on how I'm able to get the information and be able to literally get the social workers, the discharge planners' names, because those are the most important thing. Those people are the ones that's going to refer people to you, refer clients and patients to your company. But first you need to be able to spark the interest, get their name first. So what I always recommend for people is this, is that during the weekday things are really, really busy. You don't need to speak to them right there and then. Gather information. Gather, spend one whole day of calling your top 50, top 100 places or people you want to get a hold of. And this is one quick technique that I kind of do. And I want you guys to listen to this phone call. I'm going to bleep out the name of the company if whoever answers the phone correctly says their name. Now remember, your team, when your staff is answering their phone, they better mention the name of your company. This is ABC Home Health. This is Michael. How may I be of service to you? They need to be able to have that spiel. Countless times you're going to hear people answer the phones the wrong way, where they're just going to say hello. They don't even mention the name of the company. They don't even mention their name as well. So you need to be able to learn the proper phone techniques, and that's a whole other video series that we have. What we're learning today is literally being able to how to be able to get the names of the people. And not just the names, try to make sure we get the spelling and the pronunciation correct, okay? So let's go ahead and try this phone call right here. Hi, this is Michael. I'm trying to send something over to your administrator. I just want to make sure I got the right name of your administrator. Is it still Kimberly Sagassi?
It is.
Perfect, perfect. May I ask who I'm speaking to right now?
Maya.
Maya, one more thing also. I'm trying to get I want to be able to get the name of your your discharge planner or social worker. Do you happen to have that on you?
Okay, our social worker is Sandy Kopang.
How do you spell the last name?
Kopdang.
And if you don't mind me asking, Sandy, is it S-A-N-D-Y or S-A-N-D-I-E?
S-A-N-D-Y.
D-Y, perfect, perfect. And your name?
Maya.
Maya, I just want to say thank you so much for your time and have a beautiful weekend, okay?
You're welcome. You too.
Have a great day.
You too. Bye-bye.
Now, as you guys saw there, I was able to get information about the company, and she did a good job because she actually was able to mention the name of her company, but of course you guys didn't hear that because I bleeped it out. Now, in addition to this, you guys probably know I already knew the name of the administrator. Very good information that I got previously in a previous phone call. Or at the same time, it depends on what state you're in. If you're in Illinois, if you're in Florida, if you're in Ohio, California, wherever you are, if you actually research a little bit the websites or the local state authority who's in charge of the nursing homes or the assisted living communities, most of the time is you can actually obtain the information of who the administrator is. Administrators are good people to be able to get a hold of, but the most important person is to be able to get a hold of the social worker and discharge people, because they're the ones that's going to be, it's their job to ultimately find a resource, to find someone to care for these patients. But you need to be able to be with the administrator as well, because if you can speak to the administrator, have a good rapport with them. And once again, we have a full series on how to be able to build trust and influence people, to have them look at you as a friend, as a trusted partner. You want to be able to build rapport with the administrator as well, so that you can have that introduction with the social worker or discharge planner. So as you guys saw, that's another way on how to be able to handle things, is to make sure you are able to call ahead and get the names of the people. So the particular person that I got a hold of, I made sure I spelled the things correctly. And in addition to what I did is, now that I have the name, I can literally just make a phone call and literally do my cold calling techniques and get her on the line. Because I can literally call and say, I need to speak to so-and-so. A very good technique, and you want to be prepared with that. Another quick tip on this one is this. Literally call on the weekend for this information. Why? Weekdays, there's so much calls coming in. They're being bombarded left and right. Whereas in the weekends, are a little bit slower. And at the same time, is the people working in the weekends are part-timers. They're not the full-time gatekeepers. The ones in the weekdays, those are trained to be able to spot people. And you need to be able to learn how to go past that. This is another great technique on how to be able to get a hold of the discharge people at the hospitals. Call on the weekend, get them to get those social workers, those weekend social workers, to give you the names of their managers for the weekday. Very, very good choice. Let's try this again and see if we can actually do this on another call. Let me go ahead and try another phone number here. Let's make sure that, to show you guys a couple of them. I hope that you can actually hear, because I just put my phone on speaker.
This is Kay. Can I help you?
Hi, Kay. I'm calling to see, I'm going to be sending something over to your administrator. I just want to make sure that it's still the same person. Is it still Neil Glein?
Yes.
Perfect, perfect. And if you don't mind me asking, your social worker discharge planner, what's their full name?
Okay, we have, actually we have 4 discharge planners. Now, I'll give you the director's name.
That would be perfect.
Her name is Karen, spelled K-A-R-I-N, as in Nancy.
Okay.
And the last name, she pronounces the K also. It's Knutson. K-N-U-T-S-O-N. Karen Knutson.
Perfect, perfect. And how do I spell your name?
Me? Oh, my name is Kay, and I'm the receptionist.
Well, Kay, thank you so much for, giving me your time. I really do appreciate it. And
You're
if
welcome.
you, just have a beautiful weekend, okay?
Thanks. You as well.
Have a great day.